Okay, for all you folks out there that have apnea and you're trying your best to find any alternative to a CPAP, today we're going to look at one of the oral appliances, a mouthguard called Vitalsleep. Vitalsleep, I'll show you what it actually looks like. It's just a little plastic mouthguard that fits in your mouth, and the purpose of it is the lower portion sticks out farther than the upper portion. By doing this, it pulls your jaw forward. Now, this should work great for me because I've got a bit of an overbite. Should be out here, but it's back here. So by wearing this at night, it's going to pull my jaw forward, thus opening up the airway and pulling the tongue away from the back of the throat, and hopefully help you prevent apnea. It's basically using the exact same principle as one of these $1,000, $1,500 oral appliances that you get from the dentist. There's two main differences besides the price. One, this is made out of a cheap little plastic that you boil and you fit to your mouth, whereas the oral appliance the dentist gives you is going to be much firmer. And two, Vitalsleep technically cannot advertise that they help apnea, even though it's using the exact same principle, because for some reason the FDA does not allow them to do that. However, since we know that the principle is the same, and if this thing works, then a dental appliance will work, so let's put it to the test. Now, not only am I just going to spend the next couple of nights sleeping with this, I'm actually going to wear what's called an oximeter, which will help measure my apnea events during the night, so we can do a test to see, hey, is this thing actually working? So, no sense in delaying this thing any. Let's go see if it works. Welcome back, folks. And well, we've tried this thing here for the past 2 nights, and I've got the good, the bad, and the ugly for you on this. So let's get right to the point here. First of all, how does this thing feel? Well, just to show you this a little bit closer again here, there's a lot of stuff that's going in your mouth. It's not like a retainer. It's not like one of those TMJ guards you used to get as a kid or later on. All this goes in your mouth, which means it's really kind of bulky in your mouth. First of all, you do boil this to fit your teeth, so it will fit in there right, but it's just going to be a lot more than you're expecting. And there's also so much that your lips will close, but you're going to tend to want to drool some because they're not shut as tight as you normally are. But as far as comfort, it's perfectly fine. Just a little bulky there. But let's get to the point. Did this thing help reduce apnea? And I wore an oximeter for 2 nights on this thing. I reboiled it a couple times to make sure it fit just right. And lo and behold, we had a 50% reduction in my apnea events. And folks, that's a lot more than I expected. That's huge. And the reason is, not all of my personal apneas are a result of my throat. Somewhere around 1/3 of them are caused by obstruction in my nasal cavity. Ergo, a 50% reduction is almost all of them. That would have a huge impact on someone who has minor or middle of the range moderate apnea. It could knock it down to the normal range. So in that sense, this thing worked absolutely great. Downsides you need to be aware of. It is cheap and it breaks easy. And the other thing is, the way this thing pulls your jaw forward is it basically pushes on your lower teeth to push that jaw forward. I have one lower tooth that's just not perfectly straight, and if you have any teeth that aren't perfectly straight, it's going to put undue pressure on that one tooth. It puts so much pressure on my tooth, it woke me up in terrible pain. I had to take sleeping pills to get through the night to truly test this thing. I tried boiling it. I even took a Dremel tool out and tried to cut it some to make it fit better. It did not work. However, I'm going to have to give credit where credit's due to their customer service. They have been great to work with. They take returns without a whole lot of questions. I thought it was really nice of them. Furthermore, it did actually work if my teeth were straight and not had that problem. So, what's my overall review of this thing? For me, I can't use it. If you have any kind of misalignment in your teeth, it's going to be a problem. And one other thing you need to really be aware of. if you wear one of these or a dental appliance from the dentist, remember it's holding your jaw forward for 8 hours. When you take it out, your jaw is not going to snap back in place. The very first thing you need to do is push that jaw back in. Just kind of wrangle it around a little bit and work it a little bit side to side. Otherwise, the first time you bite down, your teeth are going to be out of line and you're going to feel like you about chipped a tooth. That's a real problem with all of these oral appliances. But I also talked to the dentist about this, Tom. He said it doesn't cause any permanent damage. You just have to make sure to push your jaw back. Does Vitalsleep work? Yes, it works. Is it for everybody? No, it's not for everybody. So I hope this was helpful to you. Please remember to subscribe to our YouTube channel, and God bless everyone.